Okay, so welcome everybody to our panel discussion today on mental health and regarding mental health awareness. This panel discussion follows our Twitter campaign that was launched today regarding mental health awareness, and there are click to tweets that are still available. So if you're interested in participating in the campaign, you're still able to. Click to tweets are available at ola.org/mental health awareness. So, May 31st wraps up Mental Health Awareness Month, and we'd like to highlight the importance of mental health and various types of mental health awareness. And so, we commonly mistake mental health as the norm, and we dismiss signs that may be apparent in ourselves or even in those around us. And so, as we know, our people, the Oromo people, are a people with a long history of generations of oppression and lots of trauma, whether it may be losing a loved one, being oppressed or targeted by the Ethiopian regime, or having to seek asylum in an outside country. It's something that our people deal with daily. So the outlet for a safe space isn't always made apparent or accentuated, making the necessary attention needed for ourselves and those that experience these things not made apparent. And so this is why conversations like this are needed and are needed more often. With that being said, I'd like to introduce our respected panelists. We have with us today Dr. Najaha Musa and Aga Ruda. Dr. Najaha Musa is a family medicine resident physician at the University of Minnesota. Prior to her residency, she served as the vice president of the psychiatry and neurology group in medical school. And while in medical school, she helped develop a mental health tracker app to promote emotional well-being and connection to resources. Working with the Minnesota Department of Health, she was instrumental in mapping and making available mental health resource data to support the state's suicide prevention efforts. Dr. Musa routinely treats mental health illnesses in her primary clinic, and she's passionate about bringing awareness to mental health and making sure patients have access to mental health resources. Agaruda currently works for Alameda County Behavioral Health Care Agency as a forensic behavioral health clinician. She primarily works with individuals involved in the criminal justice system. Before her current position, she worked as a Child Protective Services or CPS social worker for 15 years, where she had the opportunity to interact with family, youth, and children of diverse backgrounds. She has a master's in social work and is on the California Board of Behavioral Health Certified Mental Health Clinicians. So welcome and thank you for joining our panel today on mental health awareness. So just to give the viewers sort of like a background or a general understanding, my first question would be, what is mental health and kind of what are the misperceptions regarding mental health? And Aga, we can start with you. If you just want to unmute yourself.
Yeah. To begin with, I sincerely thank you, Ola, and all involved in this organizing this topic. It's really timely and very important. So when we think of mental health, really what comes to mind, because of our upbringing and the way mental health is being looked at, it's like somebody running around on the street, crazy, Maratha, that kind of stigma around it. But mental health, it affects each and any one of us. It could be it affects our emotions. It affects our psychologically, emotionally, and socially. It affects the whole being. So but the perception is that somebody has to be seriously ill and being on the street, that youth and children are not affected. That's usually the myth, but that's not true. Even children as young as very young can be impacted. Youth can be impacted. Mental health doesn't discriminate based on your gender, or social status or your age. It can affect young, a very young child, youth, and elderly. So mental health really affects our relationship to ourselves and to people around us. It can, yeah, it's the whole being. It affects the whole being.
Thank you. And Najaha, if you want to add on, what is mental health and what are some of the misperceptions surrounding mental health?
Yeah, I couldn't have said it better myself. That was a great introduction to our topic today. And again, I want to reiterate what my co-guest has stated. This is a very timely discussion, and we appreciate the opportunity to come on this platform to bring awareness to it. In plain terms, as healthcare professionals, we define mental illness based on the DSM-5 definition, which is essentially, in plain terms, emotional distress that causes sort of dysfunction in work, home, personal life. Overall, like she said, it affects your entire life. And so when that starts to happen, we need to start looking at the inciting factors and how to mitigate those emotional, distresses, so to speak. And so to your next question, I think you asked mental health stigma and what we can do about that. Is that correct?
Regarding the misperceptions.
Oh, misperceptions. So, like I stated earlier, people tend to think, oh, if someone has a mental illness, they're considered, legally crazy, or like she said, Maratha or Maratu. And, that is actually not accurate. Many people, regular functioning people, actually have mental illness diagnoses in the DSM-5 definition of the term. And I treat many patients who are, successful professionals with, say, major depressive disorder or bipolar disorder. And those are, sort of the typical mental illnesses that we see. But, we also need to think about a lot of the socioeconomic factors that contribute to emotional distress. That is a risk factor for, sort of full-blown mental illnesses, including major depression and bipolar disorder. So the misconception that, you're crazy is really unfortunate. And we have to sort of bring awareness and fight against that stigma so that we can all come together and find a better solution to this epidemic.
Yeah, definitely. And I know you both briefly touched upon some of the stigmas regarding mental health or surrounding mental health. And so my next question would be kind of, what are your thoughts on the stigma surrounding mental health and kind of the community attitudes that you both briefly talked about, and sort of like the beliefs that we have in our community surrounding mental health and what we can do to change those? We can start with you, Aga.
Yeah, the stigma is really it's very heavy. The stigma around mental health, people who have mental health condition, it's because they're lazy, or because they have some. Can you hear me?
Yes.
Okay, I'm sorry. So it's because they're lazy or they have some sort of defect, as if they're really different than the normal people. But mental health is very much common that we think. It's 1 in 4 or 1 in 5 people in our, at some point in our life can have a mental health. It's on a spectrum. It could be, based on, as my colleague mentioned, Dr. Najah, the stress in our life can trigger it at any moment, the situation we are in. So the stigma that someone with a mental health condition is because that person is weak, that person is or lazy, or they are some sort of defect. Those are the things they're really seen as if they are different from the society, and get stigmatized. They're looked down upon. That's why people don't want to come out and say they have a condition. The family don't want to talk about it. And that really makes people not to seek help. So yeah.
And so, what are some things that we can do to try to change these stigmas that exist surrounding mental health?
I think the education is very important. Mental health is like any other condition. If I have a kidney problem, I go to see a doctor. If I have a cancer, I go to see a doctor. If I have hypertension, I go, I get medication. What makes it different? Our mental, is our brain is the most sophisticated, the most complex, the engine behind our whole being. When that is impacted, our whole body is impacted. We have to educate people. It's like any other. It's even more important, as far as I can see it, even more important, because the brain is the most delicate, the most important, and the engine behind our whole being. So taking care of that is really taking care of our whole body. So there is no shame about it. If we're not ashamed of going to see a doctor when we have cancer, why is it shameful when my brain is impacted? It's like, stress impacts, mental health. What impact on mental health is the stress. It could be genetic. It's our environment. What the example I usually have think of is like, if you put a dirt in an engine, what does it do to a car, right? For me, the stress is similar to the dirt that we put in the engine, and then subsequently breaks the engine and the car cannot move. But when we have a lot of stress daily in and out, and other social factors or genetic factors that impact the brain, that needs a repair or a care. So education, I think, is the biggest aspect to fight the stigma, being aware.
Yeah, absolutely. Education is very important, because I feel like our communities don't talk about it, and we also don't know much about it. But Najah, I'll get you to add on to that, sort of surrounding, what are your thoughts on the stigma surrounding mental health and the community belief on what mental health is, and sort of what, as Dr. Aga mentioned, what are some things that we can do to help change these stigmas and these beliefs, surrounding mental health?
Yeah, I think you both have kind of touched on it. When it comes to, say, like religious communities, like the Islamic community, the Jewish or Christian communities who are very much faith-based, a lot of the times mental illness can be attributed to someone not practicing their faith or not as strong in their faith. And a lot of times they use that kind of as a scapegoat to say, hey, you need to get back on your prayers, or, get back into being more of a practicing Christian, practicing Muslim, and so on and so forth. And that is a huge stigma, and not necessarily a very helpful assessment. And so for me, I always try to educate my patients on this. And in the non-clinical setting, going to masjids and other community settings, to really say, hey, like, we as healthcare professionals, as doctors, realize that this is a medical crisis. A person can be hospitalized for mental illness. Just because you cannot see it doesn't mean it doesn't exist. And we bring, voice and agency to the issue. And once that happens, I think people are more willing to really dig deeper and ask questions that are more informing, so that they can help themselves and their loved ones get better care. And I should say that, the typical patient of ours, right, in the primary care setting, as a family physician myself, we get a ton of patients who come in for hypertension or diabetes, and we screen everybody for depression because of the nature of the illness, how it can be very much covert and go unnoticed for such a long time until it actually becomes really unsafe for the patient, resulting in a suicide or even homicide. So we screen everybody. And in that sense, we're really trying to cast a wider net to bring people into the fold of the mental health and behavioral health sort of support systems through the primary care clinics, as well as through psychotherapy and psychiatry routes. So I encourage anybody who goes in to see their doctor for their annual visit to fill out what's called the Phq-9 assessment, which is a 9-question questionnaire that sort of just looks at, like, in your daily life, what are some things that you worry about, or how are you feeling when you're going through your daily life that sometimes you feel hopeless or down and depressed. Things that you don't normally think about when you come to a doctor's visit for a medical concern. So for me as a doctor, I try to bring awareness in the community, so educating people. And then also I would recommend engaging community organizations such as OLA, as well as the organization I'm a part of, International Oromo Health Professionals Association, frequently puts on seminars for this particular topic. And then also as a community, as an organization, being able to create crisis helplines that anybody in the community can access if they're in a crisis, if they're feeling suicidal or having thoughts of hurting themselves. I think those are really tangent things to put into place to support the community and make sure that we don't end up losing someone in the community.
Yes, absolutely. A lot of the stigmas, I think, can be lessened with, starting conversations like these. And to all those that are watching, we are taking questions in the chat for both of our panelists. So if you do have a question regarding mental health or mental health awareness, please feel free to put it in the comments. So we've talked about kind of the stigma and what we can do to change it. But I think oftentimes a topic that isn't really talked about or kind of goes under the radar is generational trauma, just because of the nature of what our people go through, having to seek asylum, creating new lives for themselves. So what effect does generational trauma have on this new generation of diaspora, whether they are born in the West or they are of those that, are recent immigrants? How does generational trauma affect them? So we can start with Aga. You're muted.
Generational trauma really impact generations. If we take our own case, we grew up, like, for instance, I can take myself. I grew up in Oromia, but I grew up hearing what my parents and grandparents went through, the historical trauma. Although I haven't lived that life, the lives of my grandparents or even the lives of my father, I still felt as if I experienced it because they talked vividly what happened to them. My father would tell stories of what happened to him, being evicted from his own land, being put in jail, what my older brothers have gone through. All those are really, although I haven't experienced it myself, although I haven't been in jail myself, but what happened to people around me really impacted me. And when I left Ethiopia and I lived in a refugee camp and experienced it, horrendous kind of life, and then I moved to a third country and gone through the acculturation process. All those traumas I've experienced it, I now passed it to my kids. Although I'm far distant from my people far back in Ethiopia, I still live that life. Physically I'm here, but emotionally I'm there. We get phone calls about who was arrested, who is displaced, who is killed. All that it continues. Although my kids have not lived there, and now they're watching me. They absorbed it. Children, although children, pick up on, even in the silent of moments, kids pick up on what parents go through, even in the silence. And there are lots of research also that generational trauma is biological. It can be passed down. There is a lot written about the Holocaust and the children of the Holocaust who have now experienced, have depression and anxiety, although that's so many years past. So it's real. It can manifest itself in the form of depression or anxiety or being so vigilant. It can pass down, and it's real.
Absolutely. It's almost like an extra burden to carry that, is passed down to you as well. And to you, Najaha, kind of what are, the effects of generational trauma in our generation today, the generation of the diaspora, whether they are those that have emigrated or are those that were born and raised in the West?
Yeah, that's a great question. And just to add on to what Aga has already said, we see a lot of physical manifestations of these generational traumas, which, in the Western medicine sense, we may not always attribute it to, adverse life events, such as, obviously oppression in the country of origin, or even the actual act of really going through this immigration or refugee process to get into the United States. That all has an effect on a person's emotional well-being. And if you think about it, some children come to this country at the age of 2 months and as old as, say, 30 or 40 years of age. Each of them experience adverse life events regardless of how they came here. Things like, if children are in a house that has divorced parents, that has adverse effects on their emotional well-being. If the parent who brought the children has medical conditions, that has an adverse effect on the child. And sometimes there can even be child abuse as well. And then, of course, as children, like we look at African Americans in the United States and how a lot, for example, police violence and children actually experiencing and witnessing some of these police violence actually results in the child having a very visceral reaction to the experience, and having that have sort of a negative manifestation when they're at school. I've worked a lot with early childhood education prior to medical school, and I've experienced children like actually acting out some of these horrific incidences with guns when they're still in kindergarten. So while some of these things cannot be pinpointed and say like hypertension is exactly linked to adverse life event like police brutality or witnessing a loved one getting shot, there is ample evidence to show that we have visceral reactions to some of these adverse life events, not only in childhood but in adulthood as well, with manifestations such as PTSD and depersonalization disorders and things like that. So we see it every day as medical professionals. We recognize it. It's just a matter of being able to put policies in place, especially in the United States, to say we need to do better. We need to help these youth sort of get the right resources to help them get well and get connected so that they can thrive throughout life.
Absolutely. We do have a question from the chat. Someone is asking, they say that I know individuals who seek religious and other spiritual intervention while they can benefit from medical intervention. And so they're asking, how can we change that habit? So either one of you, feel free to tackle it.
Well, personally, it's not an either or for me. It can be both. The problem is when we think religion is the only way, and that's what is being really encouraged at some corners. For some people, even in therapy, we encourage people who are already, spiritual, whether that's Christianity or Islam or Jewish, whatever their belief system is. It's important to, have whatever they have, if that helps. But it's not at the disregard of also, other alternatives, especially if medication is indicated and as important. It's important that they have to do both. So I don't disregard, the power of spirituality in people's life. It's very important for some. Some may not care, but for those who cares, it's important. So it can be combined. It can be combined, and it shouldn't be at the disregard of one or the other.
So how do we get people to sort of change their mindset to including that medical intervention is needed alongside spiritual intervention instead of just thinking that spiritual intervention is the only way forward?
Like, I can tackle this.
Okay.
As I said earlier, I think, we have to change the mindset that that if you have a mental illness, if you have emotional distress, that it is a deficiency on your religious practice. Because if you say, go ahead and do this religious ritual because it's going to cure you, because you will have sort of, gone back into, practicing accurately or as frequently as you need to, then that is not the right way to think about it. Because say that the religious ritual fails, then you're actually more inclined to think that you did something wrong and that you are still not forgiven, or your repentance is basically not accepted. And so that's the mindset that we need to change. It's not that the practice of any religion and the rituals is exactly not good for a mental illness. Is that we have to say it's not your mental illness. It's not your religious deficiency that's causing you to have a mental illness, if that makes sense. So there's actually a term in the medical field that's known as mindfulness meditation, and that one of the religious rituals is actually that you're actually being more mindful and you're meditating. So that's one of the prescriptions that we would write for someone who is more inclined to do non-pharmacologic treatments of a mental illness, a lot of times alongside pharmacology or medications. But again, I think a lot of mental illness treatment is something that needs to be practiced every day, especially when medication is not indicated. Like I said, a lot of times medication is not indicated, and someone can be more mindful and do more mindful meditation, which sometimes includes religious rituals, to sort of bring back sort of their mental state to a better state of mind, if that makes sense. Did I answer that for you?
We would hope so. Aga, is there anything else you'd like?
I think as Dr. Najah said, I think at the core of people who opposes to mental health treatment is because we see it as deficient. The individual is deficient. So whether it's spiritually or otherwise, or socially otherwise, whatever way, it's the individual's weakness. That's the thing. Otherwise, if I have a cancer, as I said earlier, I would go to the doctor and I get medication, I'd be treated. It doesn't, as Dr. Neja said, mental health, it's not necessarily through, medication alone is not the way. There are other alternative ways, such as meditations, which could be, prayer could be incorporated in that, right? So at the core of it is that the individual is deficient. That's why, you have to repent, because you're deficient, you're not spiritually, whatever. So that's what we have to really tackle. It's not the individual's deficiency. It could be a chemical imbalance. It can be genetic. It can be, it's biological sometimes, you know, it could be environmental. It could be genetic, you know. So it's not the individual's deficiency. That's what we have to drive. That's what we have to let people know. It's real. It's illness, right? So it's not the individual's deficiency. That's what people need to understand.
Yes,
And
absolutely.
it's preventable. It's very preventable. We have to, you know, the sooner we intervene, the easier it gets. But if you just put it under the rug and you don't do anything about it, it just gets worse and worse, and that's where people take their own life. In Afan Oromo, there is, you know, although we despise or you know, has this stigma, there are also several expressions in the Oromo language that express the mental distress. For instance, there is a say, "Guyatu na tidukanay." I always wonder, and I really, "Guyatu na tidukanay" means, literally means, the day has darkened over me. Can you imagine what that means? When somebody's day is darkened, when somebody is in that space, you can imagine what a person can do. When, I don't know if the English, my English translation may not do it justice, but those Oromo people who understand Oromo, guyan na dukanay, meaning like when the bright day all of a sudden darkens and clouds you and covers you in darkness. Like depression puts you in that kind of space. When you're in that kind of space, you know, one can imagine what that individual would feel and what that individual, you know, in the kind of space that person can be. There are a lot of sayings and expressions that really shows the depth of mental health, although we stigmatize it. There is one thing, I don't want to take much of the time, but there is one Dr. Ali Burra's songs that always comes to my mind. His songs, it says, "Mal jedhani, mal himani, yero yadan ibamani." You know, yadan ibamani. When you are sickened with, I don't know how to translate it, but when you have mal jedhani, mal himani, yoga yadan ibamani, jiru jireenya wallalani. That really explains when somebody is depressed, and everything around you just falls apart. What does that look like? What does that mean? There are a lot of expressions in Oromo that really shows the depths of a mental health one can be in, but at the same time we stigmatize it. So it's just awareness and learning and educating one another. Sorry if I divert off the topic.
No, I think that was a really great mention of, you know, the examples of these types of phrases and ideas that exist within our own culture, right? Whether it be the phrases or the music. I think using that as a form of education as well is really important. But going off of that, what you said about how intervention is really important, I guess it'd be important for us to let our viewers know, you know, what are the signs that someone is, you know, going or is experiencing a mental health crisis or is going through these issues. What are some of the signs that may be visible to us as the people around them? And Najaha, you can take this one.
Yeah, no, that's a great question. So just to sort of start off, there are internal factors, and of course there are external factors, like we talked about, one being, you know, adverse life events. Internal factors actually include the female sex. So women are more likely than men to be like depressed or have bipolar disorder, two of the some of the major mental health illnesses. And then the other thing is history of anxiety. So if someone has social anxiety, if they have test-taking anxiety, or just general anxiety in different environments, things like that, they're more prone to depression. And then also someone who has low self-esteem, and of course anybody should be able to recognize if somebody is always negative, and puts out a negative self-image of themselves. Things like that would signify that they have a low self-esteem. As we talked about earlier, sort of external factors, including child abuse, chronic medical conditions, history of divorce, a disturbed family environment, lifetime trauma, and low educational status, as well as low social support and parental loss. And we screen patients in clinic for depression and generalized anxiety disorder using what I referred to earlier as the Phq-9 Patient Health Questionnaire. So things that we ask for on this screening questionnaire are, in the past 2 weeks, have they ever felt down and depressed, having difficulty falling asleep or staying asleep, trouble concentrating at work, at school, and thus that they would be better off dead, or having thoughts of harming someone else. Those are some of the things that we ask on that questionnaire. And once a person reaches a certain score threshold, then we start the process of getting them the treatment that they need.
Yeah, and Aga, given your experience as well, what are some of the signs that someone may be experiencing, or maybe going through mental health issues?
Yeah, so mental health issues are not really just one thing. Like physically, we can get sick of different things: kidney problem, liver problem, knee problem. Mental health also has different, it could be, as Dr. Najah mentioned, it could be depression, it could be anxiety, bipolar, schizophrenia. There are different kinds of mental illness, and symptoms can overlap and also can be different. For instance, the depression, it could be hopelessness. People feel hopeless, they feel helpless, sleeping too much or too little. Usually, when that kind of symptom is seen on on children or youth, young adults, we would take it as they're lazy. They're not working. They don't want to do schoolwork. They're just in their bedroom sleeping all day long. That could be like what we have to be careful. I'm not here to diagnose, so we have to be careful, because these kind of symptoms is also very normal in each one of us. It's very common. I can be sad, maybe due to various reasons. I may be sleepy one day, very sleepy, or I may not. What we have to look for is the severity of it. How often in a week? Is it like a daily thing? It has to be most days than not in a week, and goes up to 2 weeks. If somebody, a youth, for instance, would not leave her room or his room for an extended period of time, like to isolate himself or herself, that would be something I should, be watchful. Is it a regular basis? Those are the things we really have to be watching for. Sleeping too much, eating too little or too much, sometimes it affects appetite. That's for depression. So social anxiety also have its own kind of symptoms. Being fearful of going in the social setting. I don't like being out and about in a crowd. That doesn't make me, I have a social anxiety. But if it's too much for me and I would avoid every social event at any cost, maybe that's something I should be worried about. If my child won't go to any event, to family event or any community event, and that would distress her or him, I should be worried about. So it's the severity of that we have to look at. And again, it's the different kind of mental illness has different kind of symptoms. Bipolar is like that. It's, the up and down of emotions. Sometimes it's high energy, sometimes could be very low. And schizophrenia has its own, like hearing voices that other people don't see, and or seeing things that other people don't see. So it's different based on, but is what we really have to look is this individual, this child, this person, what is it that we, your people, your child, right? What is changing? Do I see any change? Is this child, behaving differently than normal? And what's that? Just being closely watchful.
Absolutely. And just a reminder for everyone that's viewing, we are taking questions in the chat. So if you would like to have a question answered, please feel free to put it in the chat and our panelists will discuss it. But now that you both have mentioned some of the signs that we can see in people that, may be experiencing mental health issues, how do we go about starting a conversation and bringing up the possibility that maybe they are, having some sort of mental health issue? How do we approach them and start that conversation? And Dr. Njaha, we can start with you.
It's a great segment into sort of, what can we do as individuals or as a community to help each other. One thing that I always try to, advise is listen without interruption and judgment. So as soon as you feel like somebody looks like they, may need to sort of vent or, talk about something that's on their mind, just listen without interrupting and without judgment. Employ active listening skills, such as paraphrasing what they're saying and reflecting on their feelings. I think that's really important. But in that regard, you're also being present and allowing yourself to be emotionally available, which builds really a strong foundation for trust between you and that person, which allows them to come back to you at another instance if they do feel that is necessary. So those are the two things that I would emphasize.
And Aga, over to you. You mentioned some of the signs that we may see in people that are experiencing mental health issues. Just adding on to what Njaha said, how do we approach them in starting a conversation? You're muted, sorry.
I do agree with most of what Dr. Njaha said. Just to add a few more. The first thing is relationship building. You just don't come out of the blue and talk, especially in a very heavy stigma-laden kind of situation. You just don't come out, even if that's your child or somebody you are very close. You have to be close to that person or try to build a relationship and be genuine, listening. So and listen and just ask him, what, I just see are you okay? Are you okay? And leave it to them just to share. Don't push for them to share. If they feel close, if they trust you, if they feel you're genuinely interested in their welfare, they will share it with you. But I think the first thing is being close and building relationship. To the parents, I would say, don't react. As a parent, I react a lot, but I try to even when I know, even when I'm in the profession, I may react. So not reacting too much, because we don't know how I'm talking a lot by talking about, it's maybe because I work with kids. I go back and forth, mostly focusing on kids, not reacting. Just tell them, just you come to me anytime. Don't rush them into sharing information with you. But if the situation is worse, maybe there are situations where you have to take a step. But starting with relationship building, being close, being genuine, compassionate, those things are important. Or if
Yeah.
they don't share with you, like with the parents, maybe is there a friend, a good friend, a close friend that they can share with? And I see that many kids, because we are culturally different. Although I am Oromo and my child is Oromo, but culturally I'm different. They may feel closer to their friend than they do to me. So having that good friend who can listen is also a good option.
Yeah, that's very important. I really like that point, relationship building. Um, so going off of that, you did mention that, that is a way that you can support your children. What are other things that families can do to support, if they notice that one of their children, is exhibiting these signs, and they may think it's something to do with mental health issues? What can they do, parents and families? What are some things that they can do to support their children? And Aga, if you'd like to continue, you're more than welcome to.
Oh, the question is to me?
Yeah.
Oh, okay. Well, as I said, it really depends on how close you are to it. If we're talking about a child parent kind of situation, what I've noticed, most children don't share. And again, it's all related to the stigma. They don't want to be stigmatized. Although you're a parent, they don't come to you and they don't share. So sometimes when you take, like if it's a younger kid under 18, when you take your children to a primary, usually the primary care screen them and they share with the parents. That's one way to find out. Another way is, gently, I care about you, I love you. But it doesn't have to be just all of a sudden out of the blue. You have to build that relationship all along. That's why I'm really focusing on relationship building. You have to make your child be open to you, come to you. Because of the cultural issue, we're not really close to our children, I have to admit. So we have to create that open space so that our kids can come to us with anything without any fear, without. So just talking to them, I care about you, I love you, but I see, some change. What's going on? Is there anything you can share with me?
Yeah, definitely. And Najah, if you would like to add, what are some things that families can do to support, whether it be a child or another family member that, they may see are exhibiting signs that they're experiencing a mental health issue? What are some things that they can do to help?
Yeah, I think the only thing I would add is if you're the support system for this person is to be able to just sort of demonstrate and exemplify positive coping mechanisms that have worked for you. So if you've had any sort of distress in your life, and you have found kind of you've you know uh, perfected some of the techniques that you use to get over that time period, I think being able to demonstrate those things even before you find out that that person is willing to open up to you or is really at a place where they're really wanting help, I think just being able to show them like how you would deal with it it goes a long way. Whether that's telling them like, oh, hey, at some point in my life, at this point, I actually took medication because I was so distressed and it helped me out a lot. It saved my life. Or hey, like I work out every day because I have such a stressful life and this has helped me cope with the stress in my life. And so just being able to be open and transparent about mechanisms that you've used that have worked in sort of coping in a positive way with mental health issues is important.
Yeah, those are great responses. Thank you, both of you. I
Just to
think
add one more thing, I
go
think
ahead.
I'm so sorry.
No, go ahead. Go ahead.
Working with the school also, checking how they're doing at school. Maybe almost all the schools have counselors in this country. Talking to the teacher, how are they in school? Because sometimes children act differently in a school than at the home environment. That doesn't necessarily mean anything. But if you're really worried in the home environment, also checking how are they doing in the school environment. Checking, having that connection with the school would help.
Yeah, that's a very important point. I think a good way to kind of conclude our discussion is to talk about resources that are available for, individuals that are experiencing mental health issues or families. What are some resources available out there to support them? And we can start with Aga.
There are a lot of resources out there. I would think of there is the National Alliance for Mental Illness. They have like local chapters almost in all of the states. There are family support groups that have common issues. They have rallies, awareness events, the symptoms of the different mental illness. It has literally everything you can think of. It's NAMI in short. It's National Alliance for Mental Illness. There are also lots of apps for young people, I think, because they are very much into social media, the apps. Some of these apps are really very good and have the approval of I think some of the what is it called? There are like anxiety Canada is a very good website. They have videos, interviews, people sharing their experience. They have focus on youth. There is app called Mind Shift. It helps how to cope. There is a CBT coach. That's also another app. There are, if people who listen, especially young people, if they can search the apps, mental health apps, there are a very good one. But just don't use anything you see. It has to be. I'm sorry. Yeah, there are lots of apps too.
Yeah, thank you. And Najaha, what are some resources for people that are going through a mental health crisis or experiencing a mental health illness, and even the families? What are some resources that are available to support them?
Yeah, I think Aga already mentioned the greatest kind of resource that the U.S. or the sort of like the federal system has put in place, which is NAMI. There should be local chapters, and they usually have crisis hotlines that someone can reach out to in a moment of crisis. There are mobile clinics that come to you in time of crisis. So there are lots of resources through the NAMI website as well. For those who like to, first of all, get educated and get informed about the topic of mental health and its importance in our daily life, I would recommend podcasts on the topic. Many physicians actually talk about the topic in a kind of in a layman's terms on podcasts, whether that's through Apple or Android. But wherever you get your podcast, look up the topic, and there should be plenty of resources there. And I will put in a plug for family physicians. We deal a lot with mental health next to psychiatrists and of course psychologists who do cognitive behavioral therapy. But if you have a family physician, if you have a family doctor, that is the first place that I would recommend you go and talk to about mental health in general. Get screened for any kind of mental health irregularities. And it's really the kind of the gatekeeper to whether you need a medication or whether you need psychotherapy or therapy, talk therapy for kids, play therapy for children. Like all of that, I think a family doctor's office will have resources too. And so not to sort of put it all in one place, but family physicians' offices will be the best place to go for a mental health diagnosis and a first treatment.
Awesome.
There are 2 good books I would recommend. One is What Happened to You? I think it's authored by Oprah Winfrey, and I forgot the guy's name. What Happened to You? It's really more of like the trauma stuff we talked about earlier. And then the other one is Our Body Keeps Score. I find those 2 books really very good for those who likes reading.
Yeah, those are great resources. Any last comments or things you'd like to add on, either of you?
So for me, I once again thank you, all of you who organized this. But I hope it's just the beginning. It's not the end. This kind of topic is not something that we just talk once and then that's it, once for all. It has to be really discussed. We have to reach out to our people. All of this discussion we talked about is mostly really maybe for youth who and families who understand English, but we have to reach out to other people who don't speak English. So it has to be, the awareness has to, we have to just do it again and again. That's how we reach out to people and help, help them and ourselves understand more about it.
Thank you. And Najaha, any last comments?
No, I think that really puts it in a good place for us to stop. This was obviously just the start, and really requires ongoing discussion about the topic so that people know where to find the information and can, put faces to the people who are actually working in the front lines of mental health, whether that's myself or Aga, my colleague. And so just reach out to any of us. I'm hoping that Ola does have, like a contact person if somebody wants more information or wants connection to any of your guests on the topic. So just reach out. Don't hesitate to do so. And then I just want to say that, mental illness, I deal a lot with in the hospital setting, a lot of children, like a children's hospital committing suicide and things like that, very traumatic experiences. Can you imagine that somebody has such a pain that you cannot pinpoint on their body, but they feel better if they've actually hurt themselves? Like that is a physical illness that is a pandemic. It's becoming a pandemic since the COVID-19 pandemic. And so just imagine how much pain someone has to be to want to hurt themselves physically. Like that is a pain that is unimaginable and that we have to be ahead of and try to treat. And so if anybody's experiencing those symptoms, I would recommend that they reach out to anybody in their life or a healthcare professional. So that's where I'd like to end it.
Absolutely. And if anybody has any general inquiries, they can always email info@ola.org. And if you would like the contacts of either of our panelists, we will be able to give them to you. But thank you both. This concludes today's panel on mental health awareness. This is a big topic that, like you both said, that we hope this is the start of something that continues in the long run, and that we try to reach all corners of our community, whether it be the youth, the elderly, the old generation, the new generation, and trying to make sure that all these resources and the knowledge is accessible to all of them. And so I thank you for taking the time to unravel this difficult and challenging topic. And we thank the viewers as well, those who have stayed with us till the end, for tuning in. And just a reminder, our campaign is still ongoing. The Click to Tweets link is ola.org/mental health awareness if you'd like to participate in our campaign. That is